This is Dr. Beth Benin. We're joined by the chair and lead author of the policy statement, Dr. Daichi Shimbo, director of the Columbia Hypertension Center in New York City. How do you feel that, in addition, that self-measured blood pressure is more efficacious or signifies or relates to healthcare outcomes compared to usual care or the 24-hour blood pressure monitoring?
There is observational data that suggests that out-of-office blood pressure, either by ambulatory blood pressure monitoring or self-measured blood pressure monitoring, is a stronger predictor of cardiovascular events and mortality when you compare that to blood pressure measured in the office. What's important to highlight is that virtually all of the randomized controlled trial evidence on blood pressure control to cardiovascular outcomes was dependent on office measurements, and where the targets and the effect of drugs or non-pharmacologic therapies really were on office blood pressure. However, there's been multiple randomized controls trials that show that compared to usual care, it's typically going on in a physician's office, the use of self-measured blood pressure monitoring in addition to usual care, which of course includes office blood pressure measurement, does lead to reductions in both systolic and diastolic blood pressure in the office at 6 months. So in other words, home monitoring or self-measured blood pressure monitoring does improve office blood pressure compared to office blood pressure alone. The important thing to highlight is that those effects I just named are short-lived. The trials have shown that there improved blood pressure control at 6 months, but really no difference or reductions in systolic and diastolic blood pressure at 12 months. However, there are other studies that show that you can get reductions in blood pressure and improved blood pressure control at 12 months when you combine self-measured blood pressure monitoring with what's called co-interventions. And what co-interventions are things like education, telemonitoring, behavioral change management, communicating treatment plans to patients, medication management by nurses or pharmacists, as well as adherence contracts and prescription monitoring. And they've shown, there's a lot of data to show that when you do co-interventions along with self-measured blood pressure monitoring, you actually have blood pressure control at not only 6 months, but also 12 months.